There are so many things under calcium abnormalities. But for today, one thing I've seen a lot of candidates struggle with is the cause of hypercalcemia. And what we will also do is we will go into, so when we pick a particular course, we will not just look at the course as a course and just run off, but we'll look at the course and then take our time to review how to be able to pick those things up, so far as a board exam is concerned. So let's break them down one by one. First, you have to remember that hypercalcemia means too much calcium in the blood. Hypercalcemia, it means too much calcium in the blood. Now, though it can come from many causes, I want to know, doctors, please, in the comment section, type it for me to see. I want to know the two giant things you need to rule out in a case of hypercalcemia. I want to see if you know it. What are two diagnoses you need to rule out? You see a patient with elevated calcium levels. What are two things you need to rule out? Please, just let me know. I want to know. What are two diagnoses you want to rule out? Like two top diagnoses which should come into your mind. If you see a case of hypercalcemia, two diagnoses you must watch out for. Good. Dr. Noel just mentioned malignancy, and like Dr. Oriasoti is also saying bone metastasis. Sure. So it's in there. Two things you must know so far as hypercalcemia is concerned. So I've seen one, malignancy, malignancy. And there was the second one. There are so many causes of hypercalcemia, but these are the two most common causes: hyperparathyroidism and malignancy. So what am I talking about? Two diagnoses to always think about in a board exam. When you see hypercalcemia, before you think about any other thing, are primary hyperparathyroidism and malignancy. I need you to write this down, please. I need you to write this down, doctors, please. I need you to write this down.